Hospital hygiene is a universal topic around the world. But are there universal questions and answers in this area? International experts are exchanging views about these topics right here at the GHE Jubilee Congress in Berlin. And MedicaTradefair.com is here with a camera.
There are two main topics we have in our hospitals. This is the availability of qualified personnel, staff in all fields, nurses of course, doctors and other specialists we need. This is the one issue, and the other one is we need investment money, investment resources to carry in the hospitals the possibilities of innovation, of process innovation, building innovation, medical device innovations. These are the two main issues, challenges.
Good hygiene is not only achieved through discussions. Also, knowledge has to be put successfully into practice.
I think one of the major issues still is that there is a lack of awareness of the problem. So I think hospital management and also frontline workers need to be more aware about the seriousness of healthcare-associated infections. And as a consequence, there is often a lack of allocated resources for a functional infection prevention and control team, resources to have enough staffing at the front line, and also resources to buy adequate material. I think it is a change of attitude towards, as a consequence, towards this problem. I think hospital management or hospital managers, they can allocate budget. They can increase staffing. They can look at proper procedures and processes in the hospital. They can introduce surveillance. They can allocate resources to education and training. They can provide internal guidelines which are adapted to the local context. There are many ways that can really improve the situation. One of the problems we have with materials is a problem with ergonomics, and on one side, and the problem with handling the material properly on the other side. The ergonomic problem is that the industry often come up with a product, and a company has their own product, and they think of this product, but they do not think that this product finally is a part of a process. They do not think in processes. I think what the industry should provide is thinking in processes, because work at the patient is a process and it's not just one material or one device. So what we need is actually that companies work together to come up with a solution that really contributes to improve the process, and not just this one device. And we have, by the end of the day, grab into 10 boxes to come up with all the material we need.
A hygiene concept barely can come to fruition without industrial support. Connection and networking between manufacturers and end users are essential for the success.
If we take in particular the field of hospital hygiene, certainly there's a lot to be said about collaborations, and on the occasion of several meetings I had recently, We have been told that it would be very nice if the hospital community talking about infectious diseases would get together with the companies out of the industry in order to come up with better and improved solutions. So everybody, I think, will gain from this tremendously, and I'm sure there will be, sooner than later, there will be efforts and alliances that will exactly do these types of cooperations.